Because it's Valentine's Day, it is a fitting reminder that it's also Heart Health Month. And it's really an important topic because heart disease is still the leading cause of death in the United States. A very disturbing statistic. Apparently, heart disease takes the life of somebody every 33 seconds.
Yeah, it's a grim reminder, right? And unfortunately, it's held the top spot since 1950. But doctors are trying to make sure everyone is informed and giving them the information they need.
And lucky us, we have ABC's Chief Medical Correspondent Dr. Narula here to talk about it. Thank you so much for being here, Dr. Narula. And we're excited to be able to introduce you to our audience at Mornings at 10. For those who might not already know you, your background is as a cardiologist, right?
It is.
You are the perfect person to talk about Heart Health Month. We'll jump into it. Okay, tell us about heart disease. Why is it so prevalent? Right. You know, that statistic's pretty staggering.
It is.
Yeah, I mean, I'm so glad we get February to talk about this because obviously I see patients in my office all the time and so many people are unaware of those stats that you just mentioned, that it really is the leading cause of death for men and women in this country, killing more Americans, we say, than all forms of cancer combined. So it is really important that we start to kind of think about cardiovascular disease. And heart disease is a big bucket term that really means disease of the arterioles, vessels that supply blood to the heart, the valves, the heart muscle, the electrical system. So the heart has all these components. And then when we add in the cardio, that's even the brain health. So it's a big bucket term, but really important to understand risk factors and know how to kind of work on prevention.
I mean, you know, all of these words are buzzwords for me because I have it on both sides, as I shared with you. You know, my mom is on heart medication. My dad has had stents in his heart. He's had a stroke. This stuff really scares me. And I know that there's certain groups, there's certain folks who have to deal with this at a higher risk than others. Can you speak to those people who are higher risk?
So we like to think that almost everyone is really at risk, right? And that, you know, we have to start thinking about heart disease in our 20s because the seeds of heart disease really start that early. When we look at the arteries sometimes of teenagers, we already see plaque buildup. And so lots of times you have no idea that you have heart disease until the day you have your heart attack or the day you have your stroke, because it can be quiet until that moment when it's not. And so when we think about risk factors, obviously age is a risk factor. So generally risk goes up for women over the age of 55 or postmenopausal, men over 45, high blood pressure, high cholesterol, diabetes, lack of exercise, mental health conditions and stress are risk factors, lack of sleep, poor diet. So there's a whole list. And then women, we talked about on Go Red Day last week.
Go Red for women.
Right. They have their own set of female-specific risk factors that are important, like things that happen during pregnancy or migraine or autoimmune conditions. So really great to sit with a cardiologist, even if you feel well, even if you don't think you have a lot of risk factors.
If plaque can build up that young, that tells you something.
Yeah, I wish I could have a conversation with my 22-year-old self, but I can't. So maybe now in my mid-30s, I can start working on it. It's not too late. So what can we do to lower our risk?
Yeah, so first of all, you can know your numbers. And so the main numbers we think about are blood pressure. Generally, you want your blood pressure to be in the 120s over 80s range. Once it's over 130 over 80, that's high blood pressure. You want to know numbers like cholesterol, body mass index, your height-weight ratio or waist circumference, and your blood sugar. There are also screening tests that we can do as doctors to try to figure out your risk. One is a calcium score, which is a test that I love to talk about. Very quick CAT scan of the heart that looks for spots of plaque underneath that you may not know you have. We also have risk calculators where we can plug in your age, your gender, and some other information about you and tell you you have a 10% chance of having a heart attack or a 20% chance in the next 10 years or over your lifetime. So really giving you that information. So really, again, great to sit down with your doctor, go through all of these things, and hopefully understand better what your particular risk is and how to take control of it, because 80% is preventable by the things that we can do.
Okay, did you hear that? 80%. And that is why all of these tips that you're giving are things that really people should employ in their lives.
I was just curious, and that's, you could just ask to your general physician, just, hey, I want to do these tests, and they'll
You can, you don't have to see a cardiologist. You can definitely talk to your internist or general doctor about it and really get the ball rolling. But certainly always a great idea to sit with a cardiologist.
We know we are our own best advocates, right? So meet your doctor halfway by knowing what we need to be aware of ourselves. Dr. Narula, thank you so much.
And welcome.
And welcome.
Come on back anytime.
So great to meet you all.